The main purpose of the spinal cord stimulator is to relieve pain by interrupting the pain signals before they get to the brain. You know, if you stub your toe or you have a pain somewhere out in your foot or your arm, you don't perceive that pain until that signal gets transmitted up the nerve and up through the spinal cord to the base of the brain. And so the spinal cord stimulator sits in between there over the spinal cord and scrambles that signal so that you don't perceive as much of the pain. It doesn't completely eliminate it, but essentially turns down the volume on it. There are many scenarios where patients can be considered a candidate for spinal cord stimulation. The most common that we see is degenerative changes in the spine, which everybody gets, and so pain related to that, either in the neck or the back, going down the arms or the legs, what we refer to as spine-related pain. Those patients who have kind of gone through conservative measures and still have pain, they are a great candidate. Certainly, there are some patients that are going to need a surgery, but some patients decide that they don't want the surgery anyway. They may be a great candidate for it, or maybe their MRI shows that there's nothing to fix, there's nothing to operate on. That's another great candidate for spinal cord stimulation. And then there's some other reasons, patients who have heart-related pain that we call angina, and they've already been worked up by their cardiologist. They don't have any other issues that need to be fixed. They're a really great candidate for it, or maybe some vascular conditions, or if there's some nerve damage with something called complex regional pain syndrome. That's another great candidate for spinal cord stimulation. When it comes to implanting a spinal cord stimulator, pain doctors and neurosurgeons approach it a little bit differently. Pain doctors put the stimulator leads in over the spinal cord in what's referred to as a percutaneous technique. They do it through a needle. They make a small incision in the back that stays fairly superficial. The neurosurgeon, on the other hand, goes down and has to remove a little bit of bone and ligament to be able to put a different type of device in called a paddle. And each one of them has their pros and cons, but they both have the same final effect, which is to alter that pain signal that's going through the spinal cord so it's not perceived as pain. A neurosurgeon has some options for doing a trial of spinal cord stimulation that a pain doctor may not have. As a neurosurgeon, we have direct access to the region of the spinal canal, and so even if a patient has scar tissue or prior surgery in the area that you'd want to put the spinal cord stimulator, most of the time we can still explore that region and put a paddle in place and create a space for it, even though there isn't a space because of the anatomic considerations. Advanced pain care really focuses on a conservative treatment approach. In general, we want to start patients with the least invasive means necessary. Oftentimes that's something like physical therapy or some mild oral medications to help somebody get out of pain. And then as we see the patient on their journey, we may need to advance those to slightly more aggressive techniques, always realizing that surgery may be necessary, but for the vast majority of cases, we may be able to avoid a surgical intervention across the board here at Advanced Pain Care. Pain is inevitable, suffering is optional. Advanced Pain Care, the pain stops here.